our next discussion is called Let's Talk About Women's Health, Fibroids, Cancer, and More. So again, we want to really elevate women's health because without us, we're the chief medical officers of our family. Unless you have your health, you have nothing. So our next panel will discuss the importance of Black women's health. Black women in the U.S. are up to 3 times more likely than white women to have fibroids and twice as likely to be diagnosed with cancer. So I'm looking forward to some real talk. So we also want to make this interactive. So if you all have some questions that you want to throw out, we're going to time it so that, Deidre, we want to add questions so that everybody can ask some questions. So we have an amazing panel. So as you know, we have model Real Housewives of Atlanta TV star and actress, Miss Cynthia Bailey, who will share her experience with fibroids. And we thank you, Cynthia, because often we don't think, celebrities ever have health challenges. So this real talk is really going to help people. Next, we have founder and CEO of Radiant Women's Health in Metro Atlanta, a leading voice for women's health, Dr. Julianne Adams Birt. Now in her 17th year of practice, Dr. Birt is a sought-after speaker on women's health for local and national conferences. Next, we have breast surgical oncologist and chief surgery at City of Hope, Atlanta. She is the leader of Atlanta's Women's Cancer Center, Dr. Anita Johnson. Dr. Johnson has been published in numerous journals, including the American Journal of Surgery and seminars in surgical oncology. And last but not least is Dr. M.J. Collier. He is the producer and on-air personality of the Your Health is Important radio talk show. He's also a cast member of the Ricky Smiley Morning Show and currently serves as board chairman and CEO of the Heritage Fund of the Atlanta Medical Association. Please extend a hearty welcome to all of our guests. I love it. It's at the Black Health Matters Summit that we elevate and congratulate and love on our Black doctors and celebs like nobody's business. So this is great. All right, so let's shine a light on fibroids. Ladies, how many of you know someone who has fibroids? All right, so let's get in some real talk. Cynthia, you've experienced it.
Yes, I have. I first found out about my fibroids after I became pregnant with my daughter, Noelle. I had never heard of fibroid. Of course, I was like, oh my God, what is this? And basically, what I remember the most is my doctor telling me, oh, it's just a fibroid. It's fine. You don't have to worry about it. My main concern was whether or not it was going to hurt the baby. No, it's fine. So life went on. Noelle is 23 years old now. But anyway, taking you guys back to when I think I had the procedure, the UFE procedure, when I was 40. Anyway, long story short, what ended up happening is it just started to grow and grow and grow. And I was already experiencing very heavy menstrual cycles. I was anemic. I had a number of different things going on as a result of these fibroids. I was always, as someone in the public eye, I was always on the baby bump list. Everyone always thought I was pregnant because I had a stomach, and it was the fibroids that kept growing. By the time I got the UFE procedure done, I think the fibroid, the biggest one, was maybe about the size of an orange. So for me, the biggest takeaway from just dealing with my fibroids, I no longer have fibroids because I've just, sorry, I need some water. Give me 1 second. Okay, so I no longer have them. I'm also 55 years old, so I'm like in perimenopause, so all of that's like kind of phasing out of my life anyway. But I still like to continue the fibroid conversation because it was something that impacted my life. It completely changed the quality of my life. I basically didn't have a life. I was either getting on my period or getting off the period. And, I won't even get into like the sex life because it was just almost non-existent during that time. So I encourage anyone who is dealing with fibroids to definitely see what your options are. It is a horrible way to live, and you don't have to suffer in silence. Like, it's not something that, people aren't talking about now. And I think as Black people, we just have to normalize just really just being more open to the things that we're dealing with, and we don't have to suffer by ourselves. And, that's something that, well, that's one of the reasons why, as someone that you guys see on TV, I started talking about it years ago before a lot of other celebrities started talking about it. And I also remember when I did the show, when I was on The Real Housewives of Atlanta, it was something that I wanted to talk about on the show and film the UFE procedure on the show. Okay. And with all the things that I've done on The Real Housewives of Atlanta, that is definitely one of the things that I'm most proud of sharing, that part of my life, because a lot of people, they don't think, like, for whatever reason, that celebrity people go through the same things that they're going through. And I do remember my producers at the time said, oh, I don't know if that's going to be good TV. I don't know if, women want to know about that. And they were so wrong. Everywhere I go, anywhere in the world that I go, women come up to me today, like, no matter what else, and I do a lot, but they talk about these fibroids to me all the time. Apparently, everybody watched the show that had them and went and did something about them. So I'm really proud that I was able to use my voice and continue to use my voice through USA Fibroid Center as a brand ambassador for them to just keep the conversation going. Although personally, I no longer suffer, I'm just going to keep talking about these fibroids until everybody knows what their options are.
Awesome, awesome. All right, we got the Birt. Would you like to say something about fibroids?
Absolutely. So what Miss Cynthia just shared with us is so true. I do want to say that everyone does not suffer with the fibroids, even if you have them. Some people are shocked when we are diagnosing them at the time of a pelvic exam. But it is important to know if you have. And let's just talk about who is more susceptible to having fibroids. If your mama had fibroids, you should think that perhaps your heavy bleeding, the pressure that you're having, the difficulty with enduring intimacy, difficulty with having a bowel movement, getting up, if you're getting up to go to the restroom more than once or twice in a night, think about fibroids, okay? And so Black women are more susceptible to being diagnosed, and there's multiple reasons why that is. But I just want you to think about it. I actually tell patients, I'm surprised when you don't have fibroids as your reason for your pelvic pain and or your bleeding. But definitely seek out the help. A gynecologist, which is what I am, can absolutely help you diagnose it and decide, do you need to do something about it? And then, what are those options? Because there are so many different options. It depends on where you are, what stage of life you are. If you're wanting to get pregnant, if you're wanting to preserve your uterus. Not everyone, just because you're 49, perimenopausal, you're starting to have hot flashes, a lot of times people will say, oh, just have a hysterectomy. How many people, you don't have to raise your hand, but how many people's mamas had hysterectomies? Right? That was the answer to everything. And we now have so many options for you. So I just encourage, I thank Ms. Cynthia, I thank you for this panel. I just encourage everyone to seek. Now, I don't want you running in on Monday calling folks like, I want to know if I got some fibroids. But at your next exam, it may be something worth having a discussion about.
Okay, let me just say this, Dr. Johnson. So I was about 58 years old, and I was going for my PAPs on a regular basis every year, and my doctor neglected. He thought I had fibroids, and in fact, I had advanced ovarian cancer. What happened? And I'm here, though. I'm here. Sometimes what you do for a living helps to save your own life, right? So that was one time I had to take my own advice by being proactive and demanding the best in medical care. So I am here. So I had advanced cancer. What do we need to think about? Is it always fibroids? What else could happen? Dr. Johnson?
It's Dr. Birt.
I'm sorry.
Well, Dr. Johnson is a breast specialist. So
Oh, okay. I'm sorry, Dr. Birt. I'm sorry.
that's when we were looking at each other.
You want to talk about ovarian cancer?
Ovarian.
I can hit on that. Okay, sorry about that. So I'm Dr. Johnson. I'm actually a breast cancer surgeon, but I deal with women's health all the time. We all do lots of talks throughout the year. So, when it comes to ovarian cancer, and just for all women in general, you know, just like she knew her body. If you're seeing someone and you've talked to that person not once but twice and 3 times, you need to get a second opinion. And so don't allow someone to ignore your symptoms, because it happens all day, every day, but particularly with us. And so, and that's where we have a lot of fear when it comes to going to the doctor, because we don't feel comfortable. So whatever you're going through, make sure that the doctor that you're seeing, not only are they well versed, but they care about you, because it makes a huge difference. When it comes to ovarian cancer, it's still an uncommon type of cancer. Most times it does present at a later age. For Black women, maybe a little bit earlier, just like breast cancer. But if you have abdominal fullness, constipation, that's brand new to you, if you had a clear colonoscopy, then you need to see your GYN oncologist, your GYN first, and then follow with a GYN oncologist.
All right. So now let's talk about breast cancer.
Right. Okay. Thank you. So we'll talk about breast cancer. What's going on here in Atlanta is that we have the worst survival rates to any place in the country. So 40%, Black women have a 40% chance of dying from breast cancer here just in metropolitan Atlanta. And so there's a lot of work to do. The good thing is that we have lots of opportunity. And so breast cancer treatment, diagnosis, it has changed tremendously since I've been a breast surgeon over 20 years. Now, what we know today, that if you find out that you have breast cancer, you have choices. If you have a small breast cancer, what the current studies show that not all women need a mastectomy. Mastectomies actually today prove no increase in survival. So a lumpectomy plus radiation therapy, you are able to keep your breast actually with superior outcomes. And so I try and inform my women. What hurts me the most, though, is that when I see women every day and say, for instance, they are 45 and their mom was diagnosed at 40, they had a sister diagnosed at 36, and no one acted on their family history. So we all have friends, we all are relatives. Know your family history and act on it. If you go to your primary care physician and you're telling them, you know, I have like 3 or 4 relatives with 2 or 3 with cancer, and they don't act on it, you get a second opinion, you see a high-risk specialist, because today, if you are at risk for breast cancer just based on your family history, there are things we can do to prevent it. You don't have to wait to get it. We should not be in 2023 waiting on women with a strong family who have breast cancer, getting breast cancer, walking in the door with advanced disease. I could cut me off when you're ready, okay? But anyway, the other thing is that a lot of times people think if you get breast cancer, you're going to need to have chemotherapy. Most Black women do not have triple negative breast cancer, the one that always requires chemotherapy. Most Black women have hormone positive breast cancer, and when in some cases, they are able to be treated with a pill. And so it's different. So we're talking about no hair loss, some side effects, but not like the systemic chemotherapy. The other thing is that if you're at risk for getting breast cancer, you see your breast surgeon, and you're a candidate to get what's called a prophylactic mastectomy. Oftentimes today, even if you're busty, we're able to do a breast reduction, keep the nipple in place, do immediate reconstruction, so you look good. And so there are multiple options now. Today, the treatment has changed when it comes to chemotherapy, when it comes to radiation. It's no longer 6 weeks for everyone. It can be 1 week, it can be 3 weeks, it can be 6 weeks if you wait. The higher stage you have, the less opportunity you have when it comes to choices. But as I stated, make sure you are comfortable with your breast surgeon. The other thing is that if you are diagnosed with metastatic breast cancer, those little commercials on the TV, they are actually true. There are women who are living longer and longer, playing with their grandchildren with metastatic breast cancer, but we don't want to wait to get to that, because we know when it comes to survival rates, they don't do as well. But just know that you have choices, live a healthy life. We have to watch our weight. We have to do exercise. The alcohol is a big thing. More than 2 drinks a week will increase your risk. And some things we can't help when it comes to childbearing. So if you wait to have your children after 30, then you're at higher risk. So,
All right.
okay.
Can I say something?
Yes.
I just wanted to share, for those of you that are here that may or may not follow me on Instagram, I shared my mom's breast cancer journey. She found out she had breast cancer, I don't know, maybe about almost 6 months ago, and she found out through her mammogram. So I can't stress enough how important it is to make sure you guys get that yearly mammogram. I know a lot of us got behind during the pandemic and all that stuff, but that's how she caught it. And even at that point, it was stage 2, but she was able to actually, be fine now through just radiation. I think she just had the radiation. And one of the things, just going through that journey with her, I was actually still out in LA at the time, and I came home, like I'm the oldest child, so it was like almost like the roles reversed. Like she had just mentally, like soon as she found out she had it, mentally she just went into this dark place of like, she's gonna die, she's older, so, she was just afraid and just felt very alone. And, when, it's your mom, like, wait a minute, like, you're going to be fine. You have to be positive. You have to be optimistic. So I knew that I had to go to those appointments with her and just be like almost the mom in that situation. And I wasn't really expecting that from my mom, but it just mentally took such a toll on her. She's fine now, but just know that your mental, you just being positive and being optimistic really, really does help with like the physical things that are going on with your body. So just, if anyone's dealing with it, I can't stress enough. What I realize is we don't talk about the mental part of like when you get sick, just even going to the doctor stressed her out. And like even finding where the doctor was crazy. Like I would go with her to Emory and we'd get to the building and be like, okay, where is this, that? And she's older again. She's not like, didn't know where to go. And I'd be like, just navigating. So the whole process was very, very frustrating, but she's good now, by the grace of God. And I did post that to share that, not because I just wanted to put my mom's business out there. I did it strategically and intentionally because I need people to realize, especially as our parents get older, they need our help and they need that support, and we need to talk about it. I wanted to share it with everyone so that they could, if they had someone that was dealing with something like that, stay strong.
Awesome. Dr. Collier, talk to us about heart disease and diabetes.
Okay, I like to stand when speaking. A couple of things that I want to make sure that you walk away from with today. Culturally sensitive healthcare is so important. Multiple studies have shown that when you get your healthcare from a doctor that looks like you get more concerned care, you have better outcomes, you do better from surgery, you do better from every aspect of your healthcare. So take that in consideration. If you are not partnering with your healthcare provider and you can't talk to your doctor and they're not answering your questions and they're fast talking and getting you out of the room in 7 minutes, which is the standard business model for a doctor's visit, 7 minutes. I can barely say hello in 7 minutes. So then you need to change doctors. You give them a chance, you say, okay, let's sit down and talk about what I'm concerned about versus you trying to get through this visit so you can optimize your coding. Okay, so culturally sensitive healthcare. And two, I cannot emphasize enough how important it is to be your own advocate as far as your healthcare is concerned. If you are not feeling good, something your body better than anybody, and don't let it just be immediately dismissed because the doctor doesn't want to open that Pandora's box of discussion and they got to get to the next patient. Make sure that your healthcare needs are addressed at each and every visit to your doctor's office. As a primary care physician, I'm doing head to toe. And the primary disease state that I deal with is the metabolic syndrome, which is high blood pressure, diabetes, high cholesterol. These results in cardiovascular disease, which is what African Americans die from. Black people die from heart attacks and strokes. Everybody, what did grandmama die from? Heart attack. What did granddaddy die from? Stroke. It's what happens. Cancer is number 3 on the list, but way down the list. The next 3 things, including infectious diseases, pneumonia, anything else you can think of, don't exceed the number that die from heart attacks and strokes. And unlike a lot of disease states, this is a disease state we've actually made major strides in. We can lower your blood pressure. So many great strides in diabetes have been made in the last 5 years. We can treat you with medications that make it like you don't have diabetes. And you lose weight. As a side effect, number 1 side effect, dramatic weight loss. Dramatic weight loss, which always benefits every disease state that you have. So when you go to the doctor, make sure that you're getting a comprehensive physical examination at least once a year. That means including full blood work, chest x-ray, EKG. You want to get those things at minimum. You don't want to get a thyroid screening. You want to get a full thyroid panel. TSH, T3, and T4. You don't want to get a total cholesterol screening. You want to get the breakdown of the HDL, the good cholesterol, the breakdown, the LDL, the bad cholesterol, so that you actually have some real numbers that you can work with. The screening test for thyroid, TSH, doesn't tell you anything about thyroid disease. It can be normal, it can be high, it can be low. What matters is what the actual thyroid hormones are. They are so important in your metabolism. That is basically your body's thermostat. How you feel, how much energy you have, whether you're cold, ladies, you got cold feet, cold hands, those sorts of things need to be evaluated. So please demand quality care from your healthcare provider. Tell them you want everything done, but not just, I don't want to just get CT scans and MRIs. There's so many diagnostic tests being ordered for no apparent reason now. You go to the emergency room with an ingrown toenail, they order an MRI. And it costs you $10,000 when it could cost you 50. You know, so you don't want to do that. They have, I'm sharing some things with you now. They have a computer program that ties to your insurance that will evaluate what your insurance will pay for. And everything your insurance will pay for, you will get. You will walk out of there with a $300 flu shot that's free at the drugstore. You know, you will get every test known to man. They don't even tell you the results. They say, follow with your primary care doctor. They show up with a CD. I had an MRI. Why? I don't know. They told me to follow with you to get the results. I have no clue why they ordered it, what they did it for. So there's a breakdown in the healthcare system right now that results in less quality care and poor outcomes. That's why the cancer death rates are so high, because they're so worried about doing the diagnostic tests and not doing the actual treatments and evaluations. Cancer as a disease state is one of those things where we are really not treated unless you go to somebody who has your goodwill at their heart, okay? Because the types of treatments that are available, the biologics now, the non-toxic, non-chemotherapy treatment options that are available are not going to be offered to you a lot of the time. They're going to give you the traditional stuff. They're going to give you the chemotherapy. It's going to make you lose your hair. You're going to feel worse than you do with the cancer proper. It's probably going to shorten your life rather than prolong it. And, you know, those are, you know, you have to demand the best of the best. This is an opportunity where I say, find out, get a healthcare advocate. I was so glad Ms. Bailey said she worked with her mom, because she probably can go on the computer and pull up the most current diagnostic things that are available. Mom doesn't feel comfortable doing that or doesn't know how to do it. You know, so it's very important that you have a healthcare advocate that is working on your behalf. I tell all my patients, I'm your quarterback. We're going to, when they have a bad diagnosis like cancer, I say, we're going to get through this together. I say, I'm going to be with you every step of the way. You call me if you have a question about anything. I don't want you stressing. Your mental health is so important. And when you can't get the doctor on the phone and you're getting stuck by the secretary who says, you know, who never passes the message along, you know, when you just need to talk sometimes, it's a real problem in healthcare right now. I give people my direct cell phone number. They are in shock. And then they call me, they spend the first 5 minutes apologizing for calling me. I'm so sorry to bother you, Dr. Collier. I know I'm calling your cell phone. What is it? What's the question? I wouldn't have given you the number if I don't want you to use it. So don't hesitate to do so. So find your provider that you can partner with to get a great outcome in your healthcare. Cardiovascular disease, heart attacks and strokes. We want to control and prevent those disease states. I can get your blood pressure down, probably with minimal number of medicines and no substantial side effects. I can get your blood sugar down, as I stated. I can get your cholesterol down. If we take care of those three things, the next thing that's going to get you, either you're going to step in front of a FedEx or a UPS truck and get run over, or way down the list when you're 90 years old, you might get a cancer. But you would have lived a long and healthy life. Who wants to live a long and healthy life? I'm telling you, everybody wants to go to heaven, right? You just don't want to go right now. I'm not ready to go this second, Lord. Say, wait, prolong that. I want you to make sure you're tithing on gross, not net. And you make that deal with God, gonna take care of you then. He's gonna give you a good outcome under those circumstances. Okay.
All right, guys, we don't have a whole lot of time. Anybody have questions? Grab the mic. You see that handsome gentleman with the BA?
Question right here with the white hat. I'm coming to you.
Okay.
Here you go.
I want to know why is cancer so high in black people than any race?
It actually, it's not higher. The death rates are higher. And most reasons is because it's detected at a later stage, because sometimes lack of access, getting the screening done. For me, I think it's really acting on the family history. That's important.
Next
Hi.
question.
Hi, these questions are directed to Dr. Johnson and Dr. Collier. Now, Dr. Johnson, I recently I have a cousin that was recently diagnosed in her 40s, and she had a double mastectomy in November. Her mom had a history, and I went through everything with her, and she didn't survive. It was in the early 80s. To hear you say what you did today, it touches me right here because I know people are surviving.
Oh, yeah.
I need your contact information before I leave here.
Okay.
And Dr. Collier,
Yes.
I hear you often on Derek Bozeman's show.
Thank you. Locally heard on Derek Bozeman. Too much truth. Too much truth.
Yes. I want you to be my primary doctor.
I'd be happy to do so. Thank you.
Okay. Next, do we have anybody else that has a question?
I just wanted to throw out one thing before everyone leaves. This is just to piggyback on all the wonderful information we just heard from Dr. Collier. Please be very careful. In the age of the pandemic, there's been a dramatic rise in telehealth visits, and that is cool and great for a quick diagnosis. But if you have a primary care doctor, you should be going in person for that annual exam. That annual exam needs to be face-to-face. Please.
We
just
need to
remember
see
that.
you and touch you, get blood work. You can't do that by video phone.
I was gonna say that I had fibroids, well, I still have them, but I had them removed. I had my son, he's 16, but for most of my adult life, I was having fibroids, and my doctor kept telling me, no, we're not gonna remove them yet. So when he left his practice, the doctor told me, okay, we can get them removed, but she didn't tell me that they could come back a year later, as well as I may have problems getting pregnant after, because the fibroid she removed was on the tissue and stuff. So it was like worse getting them removed, and I would have rather, if I could do it all over again, would have never had gotten them removed at this point, because it was rough.
Okay, we have one last question over here.
Hi, I have like a two-part question regarding testing and x-rays. Is it true that the more x-rays you get, you're more than likely exposing yourself more? Like for the radiation, you're being exposed more? And the other question is, you would think with all the current technology we have today, that mammogram, is it ever going to change? I mean, is it ever? And we need Dr. Collier's contact information.
We're getting there. One thing about mammograms, the bottom line, I was just talking to some of my colleagues in the back, it matters where you go. I actually, my mom was treated disrespectfully when she had her mammogram one time, so I'm looking for more black mammographers and radiologists. But when it comes to mammogram, it still picks up the earliest form of breast cancer. If your breast hurt, get off the caffeine 2 weeks before, take some Advil or Tylenol. When it comes to the radiation effects, you have to have over 1,200 mammograms in your lifetime to be put at risk. So we only go once a year. So we're probably getting 30 or 40 our lifetime. So that's just a myth.
Yeah. And the radiation from a mammogram is less than that from watching that 65-inch flat screen in your home
That's
all day,
right,
every
the
day.
multiple ones.
Yeah, so you need to understand and keep it at
Right,
100.
right.
But let me tell you, the guidelines for mammography the recommendations have changed. Under the Affordable Care Act with President Obama, he mandated 13 different tests that should be absolutely free for you. Don't cost you anything, including a copay. Mammogram and pap smears are one of them. Magically, 2 years later, all of a sudden the guidelines say, well, guess what? You don't need to get routine mammograms as often. That counts for everybody but everybody in this room. Okay, so you should get your mammogram annual at least once a year. Same thing for gentlemen. Get your prostate exams, including your prostate PSA, because the recommendation from the Urological Association is saying you don't need to get digital rectal exams and PSAs as often. The only thing that's happened is that both of those cancer rates have increased along with the death rate since they changed those guidelines. So get your annual exams and don't compromise with your doctor, because if you tell the doctor, Doc, let's just bypass that this time, we'll wait till next time. I never agree with that, but there are a lot of doctors who will, because they don't want to do it either. So they just say, okay, we'll do it next time. And next thing you know, it doesn't get done. You're diagnosed at a later stage and you have fewer choices and a poor outcome.
All right.
I just want to say
Last
really
word.
quickly. Okay, I'll be quick. For you, that was talking about the fibroids, we have to get in the habit of doing our own personal research. You know what I'm saying? Before we go to the doctors, unless we go to these doctors. Obviously, they're going to tell us the right thing. But I totally resonated with what you said, because no one told me that I had to get them removed until I started doing my own research. And I was like, well, wait a minute, can I get them removed? And then I had UFE, which is uterine fibroid embolization. And what that basically does is it basically, like the vein that, okay, say this is the fibroid, right? The veins that support the fibroid, that's what helps it grow. So they basically like fill them with whatever to clog them up, and then it can't get to the fibroid and then it dies. A lot of people don't understand what that is. So what happens is you go there, everyone's not a candidate for that specific procedure. So then you got to find out, okay, well, if I can't get that, but that's an easy way to start because that's the most non-invasive one. Before you get into all the other stuff and hysterectomies, the hysterectomy should be the last resort. 100%. Like that, I do know. So please, 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 you know, anytime, one of the things that I love about my 23-year-old, anytime Noel could go get a tooth pulled, she's going to go and research everything. She's going to watch a tutorial, how they're going to take it out, what tools they're going to use, what kind of gas or medicine they're going to give her. We have to do that because a lot of times these doctors, not these people, will not offer the information. If you don't ask the question, you're not going to get the answer, because they're not just going to say, hey, you know, well, how's your, you know, your testosterone levels? How is this doing? They're not going to ask you. You have to ask those questions.
Second opinions. Please don't think you're hurting someone's feelings. I don't care. It's your body. It's your life. Your family is going to miss you. So if you don't necessarily not only like what you're hearing, but if you want a better explanation or other options, if someone says you have to have a hysterectomy, go somewhere else. I have gained lots of patients on second opinions, and they may have gone back to the other doctor and may decide something different. But I'm about educating you. Our goal is not to put our opinions on you. Now, if a patient asks me, Dr. Birt, if you were 51 trying to have a baby, what would you do? That'd be easy. But there are times when people will ask you your personal opinion. That's not what you're in that room for. Second opinions. Don't be afraid to go find one.
All right. So thank you. I want to thank Cynthia Bailey, Dr. Julianne Adams Birt, Dr. Anita Johnson, and Dr. MJ Collier for an amazing panel.